The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
Hi, this is retired Army Captain Dr. Tommy O'Brien. For 25 years, I devoted my practice and military career to not only medically treating my patients, I have educated and guided them to a healthier lifestyle which improves the quality of their lives. Please contact me by visiting drtommyo.com. That's drtommyo.com. As an osteopathic medical physician, I am able to offer more than one would expect from an MD. I apply hands-on manipulation in concert with medical treatments to not only treat the illness, but the effects as well. Additional services I provide include medical weight loss and medical marijuana. Please contact me by visiting drtommyo.com for an immediate appointment. If you don't have medical insurance, or if your medical deductibles have not been reached or are very high, I offer an easily affordable membership program which allows you unlimited visits for a small monthly premium. Please contact me by visiting drtommyo.com. drtommyo.com, or call 631-980-8200. That's 631-980-8200. And let's put you on the track to a better health and better healthcare at an affordable rate. Welcome to the Ask Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice which allows you access to quality care you really deserve. With no rush office visits, both you and I can discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. A history and physical is the starting point of a patient's story. This is the time when our physician-patient relationship begins. The patient will explain their past medical history and mention their medications. I will then perform a thorough physical exam. This is where I look, listen, and feel. I look at the patient while they're speaking to me. I listen to what they're saying. I feel them both physically and emotionally. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. Call today and schedule a history and physical. If you wait, it's too late. To my military family, I got your 6. To my Masonic brothers, the light is bright. One thing, in my opening monologue there, I had a statement that I feel them both physically and emotionally. Every patient that's come into my office, they all said the same thing, again, in their own words, that none of my physicians perform the physical like I did. I say, if you want the cheap exam, see the doctor across the street. If you want your exam done right, I'm the doc for you. Today's topic, asthma. That's right, asthma. I want to talk about the significance of asthma. Let's go over my background. I started my residency in the Bronx at St. Barnabas. I practiced there for 16 years. The Bronx is known as the unhealthiest borough in all New York City. It's one of the unhealthiest in the nation as well, and it's the leader for asthma, especially childhood asthma. It's so significant that most ERs will have a room dedicated just for asthma patients. When I was at St. Barnabas, specifically Union Hospital, which is now defunct, it's called Union Community Center, we had a room, and we had IVs, and we had nebulizer machines. So when someone had an asthma attack, we just sit them in the chair, and then we started, the treatments and gave them the proper care they needed. That's how significant, dedicating a room just for asthma patients. So what is asthma? Asthma is also known as reactive airway disease. This is a medical condition in which airways in a bronchial tree narrow and swells, in which the body starts to develop mucus plug formation, therefore making it very difficult to breathe. I'm going to go over some statistics. According to the Asthma and Allergy Foundation of America, approximately 25 million Americans have asthma. Approximately 1 in 13 Americans suffer from asthma. Just walk down the street and count 13 people. And just think about it. One of those 13 individuals is suffering from asthma. When you go into the city, it's going to be more significant. But we're talking across America. It is the leading chronic disease in children. Currently, there are about 5.1 million children under the age of 18 diagnosed with asthma. That's diagnosed. There's probably more that have asthma, but that's what we have diagnosed, meaning seeing a physician and we put in claims so we can able to develop statistically and calculate the disease itself. In 2019, 3,524 individuals died from asthma. Many of these deaths are avoidable with proper treatment. We need proper treatment. Before you can get treatment, we need to provide care. But before we can provide care, we need to diagnose. That means you need to come in and have a history and physical, and then I will listen to your heart, I'll listen to your lungs, and then I will determine if you have, based on history, if you have asthma. And then we will set up a protocol for treatment. From 2008 to 2013, the annual economic cost of asthma was more than $81.9 billion. And that's including medical costs and loss of work and school days. It's significant. So let's go into asthma signs and symptoms. Well, when you have asthma, or specifically an asthma attack, you're starting to have shortness of breath. You develop a cough, chest tightness or pain in the chest. You develop a wheeze, or what we call wheezing, and that's the sound that we hear, especially when I'm auscultating. I'm listening to lungs. I can hear that. When it's so severe, the patient can hear it. It's coming out through their mouth as they breathe. Waking up at night due to asthma symptoms, which I'm going to explain that. Well, why do we have shortness of breath? We're not able to get enough air in. There's not enough air exchange. We have what's called oxygen CO2 exchange. We need to be able to get oxygen into the lungs, and then the lungs are able to disperse the oxygen and then also remove the CO2. That's the buildup, right? Well, if we're not able to move air in and out of the lungs because the lungs are tight and they're swelling up, we start to have shortness of breath. You start to get into panting because you're starting to increase your respiratory rate to move that air. We have a cough. Well, this is a reflex, and when you have inflammation in the tissue, we start to cough. And that's one of the signs and symptoms. I know doctors, they prescribe cough medicine to asthma patients. I do not. I will not do that, because if I take away that cough mechanism, I will not know, and the patient will not know if they're starting to get tight, because that's one of the early signs and symptoms of asthma. So if you remove that cough, the patient won't even know that they're going to start to develop an asthma attack until it's not too late, but when it's starting to advance. Chest tightness. Well, we have the muscles in the respiratory tree in the chest itself starts to tighten up, so making it even more difficult to inhale and exhale. Like I said, we have the wheezing, and the wheezing is due to the inflammation in the tissue. So the lungs have very, very little resistance. So the air is able to move in and out of the lungs. We want as least resistance as possible, right? Path of least resistance. That's what we always say. That is nature, path of least resistance. So if we start to have inflammation in the tissue, you're going to start to hear, that resistance, and in the form of what we call wheezing. Now, waking up at night due to asthma symptoms. And that's due to cortisol levels. Now, I'm going to explain this, and you hear commercials about cortisol levels and stress eating. Well, this is cortisol. There's a gland in the body. It's called the suprarenal gland. The renal gland is also called the kidney. So above the kidney is a gland. It's called the suprarenal gland. That's a round, triangular shaped organ. It has many functions, but for this presentation, and we'll just talk about reducing stress. So the gland reduces a hormone called cortisol, and the function of cortisol is to reduce cellular inflammation. And so by reducing cellular inflammation, we can keep the tissue, has time to repair itself. during between 12 and 3 o'clock in the morning, this is when naturally the suprarenal gland starts to shut down so that the secretory glands, those are the glands that produce and pump out cortisol all day, are able to replenish. So you will see patients experience asthma attacks statistically between 12 and 3 o'clock in the morning. Now, if you ever had a cold, an upper respiratory tract infection, you notice you started coughing right around midnight and you're coughing to about 3 or 4 o'clock in the morning, and all of a sudden the cough dissipates because the cortisol levels are starting to return to baseline. You fall asleep 5 o'clock and now your alarm goes off and it's 7 o'clock in the morning. Oh boy, I only slept for 2 hours. Anyway, so I got, 30 seconds. We're going into break. So I just want to follow up. If you suffer from asthma and not happy with your physician managing your current care, come and join my practice. Let me help you lead a happier and healthier life. If you wait, it's too late. To learn more about my practice, go to drtomio.com. That's drtomio.com. If you prefer to stop by my office, it's located at 250 Patchogue Bank Road, Suite 16, East Patchogue, New York, or call 631-980-8200. Welcome back to the Dr. Tomio Show. I am your host, Dr. Thomas O'Brien. Today's topic, asthma. Let's continue. I left off with signs and symptoms of asthma, specifically the suprarenal gland and cortisol levels. So I just want to finish up with that and then we'll continue. The suprarenal gland, as the name states, it sits above and on top of the renal gland, which is the kidney. So it sits on top. We don't call it it's the adrenal gland or suprarenal gland. Just one of the functions has many functions, but one function is to produce what's known as the stressor hormone or cortisol. Now, as I ended part one, between 12 and 3 o'clock in the morning, the suprarenal gland, it kind of like shuts down. It doesn't go down 100%. It shuts down, and there's a reason for that. Physiologically, the secretory glands, the glands that produce and secrete cortisol, they need to replenish because they're pumping out 24 hours a day, so they need to replenish. And this is the time when most people, you can have an asthma attack any time, but statistically, you'll see asthma attacks between 12 and 3 o'clock in the morning because the cortisol levels, the function in this particular specific reason for this topic is to reduce cellular inflammation. And asthma is all about inflammation, right? There's some sort of trigger and it causes an inflammatory process. And then we have the domino effect. So this function of cortisol is to decrease cellular inflammation, but between those hours, it's at its lowest. And patients end up having an asthma attack. And we also see that for individuals who have, like when you have upper respiratory tract infection, you notice that between 12 and 3 o'clock in the morning, you're coughing, and it's keeping you up. You just can't sleep. Oh, when's this cough going to go away? And then around 3, 4, 5 o'clock in the morning, as your natural cortisol levels start to return to baseline, you'll see the cough start slowing down, then stop. You fall asleep. It's 5 o'clock in the morning. Next, your alarm goes off. It's 7 o'clock. And you just say, wow, I only slept 2 hours. I'm exhausted. Well, that's a natural physiological function of the suprarenal gland to produce cortisol, and that's how the cortisol level increases and decreases. And the function is to reduce cellular inflammation and any disease that's associated with inflammatory. Well, you're going to see that there will be a spike during that time. So let's discuss triggers. Well, there's a lot of triggers. It all depends on the person's history. I could just name a few. Someone who's seasonal. Okay, they have asthma during the seasons change. Could be weather or it could be due to the pollen. Then we also have what we call performance, where the athletes and let's say they're runners and they start to get inflammation in the lungs. You'll see athletes and they'll have their pumps with them. And that triggers an asthma attack. Why? You have any inflammation, irritation in the bronchial tree, and you get an inflammatory reaction, and then that triggers the whole cascade of reactions, which leads to an asthma attack. So, what do we do? How do we treat this? All right. Now, first is you need a thorough history and physical. Come to me and I'll do a thorough history and physical, and I'll ask you questions based on history, and I'll also ask how you've been treated in the past. A lot of times people are being misinformed. They're not trained properly. Again, I trained in St. Barnabas in the Bronx, which is the leader for asthma. So I treat my patients, and I do very well. And sometimes I even do better than some of the pulmonologists because of my experience and exposure. I mean, they have fancy tests, spirometry, flow, all these advanced tests. It doesn't necessarily mean they're going to treat the condition better. You have to understand the physiology and the pathology that's behind the condition itself. So typically we start off with a short-acting beta agonist, and you say, well, short-acting, what does that mean? Okay, that's a fancy term. Now I'm going to name some medications. I'm not here to promote any of them. I don't endorse them. I'm not getting paid. It's just names that you become familiar with. So the first one would be Preventol. Then we have Ventolin, albuterol, and then a newer one. It's called ProAir, and that's going to be. I had a rhyme for the kids in the Bronx. So they can remember how to take their medications in the proper way. So the rhyme is white, yellow, and blue stays with you. And those are your short-acting beta agonists. Those are what we call your rescue or emergency pumps. A lot of times they would bring in a long-acting or a corticosteroid, which I will go into, and as their rescue inhaler, I go, no, that's incorrect. You're using it wrong, and that's why you're not getting the proper results. You're not getting good results. It's poor results. Now we go into long-acting beta agonists. And what is the function of a beta agonist? It's to open up the bronchial tree, the airway. It opens it up so you can breathe better. Which came out my senior year residency in 97, which was Ceravent. So that's basically a very long-acting Preventol or albuterol. Then we go into the corticosteroids, and these are the gold standard. So depending on the type of asthma you have and how often you have asthma attacks, if it's only once in a while, then we can come up with a program how to treat it. If it's just seasonal, but if it's an individual that has several asthma attacks, throughout the week, throughout the month, every month throughout the year, then your approach is going to be different. So the gold standard is what we call corticosteroids or inhaled steroids. And typically we'll use Flovent, Pulmicort, or Asthmacort. When I was in medical school, we were using Asthmacort and Pulmicort. I use Flovent. It's a very good medication. The function of the corticosteroid is to reduce inflammation. Okay, corticosteroid. This is going to be similar to cortisol. Okay, reduce inflammation. So we need to reduce the inflammation at the cellular level. Well, reducing the triggers. Remember, it is a domino effect, a cascade. We want to prevent inflammation, and then we'll reduce the risk for developing an asthma attack. All right, then we have combination long-acting beta agonists and corticosteroids, and that would be Advair and Symbicort. I trained with, later on after I graduated residency, we came out with, my senior year residency, Advair came out, and it came out with a inhaled powder, which always, I would always question the drug rep. I said, a powder? You're putting a powder in a lung? That could irritate. And he's like, no, you'll be fine. Eventually, they went to Advair. The makers of Advair, they went to a pump. And then Symbicort, that came out in the early mid to late 2000s, and that one has a little dial on top. So you're going to have the long-acting Preventol, and then you're going to have the corticosteroid. We also have mast cell stabilizers, and what we want to do is, at the cellular level, we want to make sure that the cell is stabilized, so so the tolerance and the threshold, whatever's triggering the asthma, we want to increase the threshold so it doesn't trigger it. So a mast cell, we stabilize the mast cell, and we reduce the risk for developing an asthma attack. So we got about a minute and a half left. If you're unhappy with your current situation, your physician's not listening to you or mismanaging your asthma, please give me a call. All right? I'd love to care for you. You need to look, listen, and feel. You need to look at the patient and listen to him when they're speaking. You have to feel him emotionally as well as give him a thorough exam. If you're not texting your patient, you're not listening to your patient, you're just typing notes, you don't know your patient, and your patient feels this. So we need to do a thorough history and physical. I do this. I spend the time. A history and physical is 1 hour, not 5 minutes. It's 1 hour. My follow-ups are 30 minutes. So come and see me. Get the care you deserve. So if you suffer from asthma and not happy with your current physician and the way this individual is managing your care, come and join my practice. Let me help you lead a happier and healthier life. You wait, it's too late. To learn more about my practice, go to drtomio.com. That's drtomio.com. If you prefer to stop by my office, it's located at 250 Patchogue Yaphank Road, Suite 16, East Patchogue, New York, or call 631-980-8200. That's 631-980-8200. If you wait, it's too late.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.